Welcome to the fourth topic of 8 in Unit 1, Section 3, Pathophysiology of Common Injuries and Dysfunctions. In this tutorial, we are going to cover ligament sprains and bursitis. We will start with ligaments as you have already covered these in Level 3. This will be a bit of a recap for you. A ligament sprain is caused by overstretching the ligament. This can be a consequence of an external trauma, such as being tackled, or as simple as turning your ankle, which we've probably all done. Like tendons, ligaments are avascular. They have a poor blood supply, which means they are slow to heal and don't often fully heal. Ligament injuries can often leave the joint unstable to varying degrees. Like muscle strains, ligament sprains are divided into 3 categories, 1 being the most minor and 3 being the worst. A Grade 1 ligament sprain is classed as a mild sprain, with minimal damage. There will be a little to no loss of function, mild pain on palpation, active and passive movements, and stress tests. Note here, muscles and tendons are painful on resisted movements as well, so this will help eliminate one or the other. There might be mild swelling and slight skin discoloration. Grade 2 is a partial ligament tear, or classified as a moderate sprain. There will be severe pain on palpation, when at rest, on active and passive movements and stress tests. There will be obvious swelling and bruising, and the joint function will be compromised due to joint laxity. Grade 3 is a complete rupture of the ligament, or severe sprain. This will be extreme swelling and bruising, total loss of function or extreme laxity, and initially the injury site may lack pain, but the onset of pain will come over a short period of time. There are a lot of ligaments in the body, but a couple that are very common to injure are the deltoid ligament of the ankle, which is on the medial border. This is an eversion sprain. More commonly is the anterior talofibular ligament on the lateral border of the ankle. This is an inversion sprain or rolling of the ankle. Medical professionals will use something called the Ottawa ankle rules to help distinguish between fractures and sprains. Although this is not 100% accurate, it can be a useful tool. Knee ligaments can be susceptible to injury when a lot of sport is played, mainly the medial collateral ligament due to side-on tackles and the anterior and posterior cruciate ligament, which are found within the joint capsule. As a sports massage therapist, you are limited to the treatment you can do that will directly benefit the ligament. Obviously, the level of injury will be your first guide to treatment. If you have added something like ultrasound to your skill set, that might be appropriate treatment. Frictions can also be useful if healing has ceased and needs to be encouraged. Often when we damage a ligament, other tissues in the area can be affected, for example muscle spasms, and these can be treated. Compensatory issues can be a problem, and these can also be addressed. In severe cases of ligament injury, medical attention should be sought first. Next we look at bursitis. This is inflammation of the bursa, which can be caused by excessive friction, extrinsic trauma, conditions such as rheumatoid arthritis or an infection. Common signs for bursitis is pain in the area of the affected bursa, pain on palpation, and a reduced range of movement. Superficial bursas can often be clearly seen as a distinguishable slightly soft lump or swelling. There are a lot of bursas around the body, but there are a few common ones such as the olecranon, often irritated by leaning on your elbows, calcaneal and pezantherinus, often irritated by friction, prepatella, also known as housemaid's knee, suprapatella and infrapatella are generally irritated by kneeling a lot. The deep and superficial trochanteric can be irritated by sleeping on your side, and the subacromial bursa often irritated by friction. Before any intervention is carried out, you need to know the source of the issue. If there is a clear reason, then treatment will be fine, but if you are unsure and are concerned it is an infection or rheumatoid arthritis, then medical guidance should be sought. Directly treating the bursa with massage won't help, but again working around the area can be of benefit, for example loosening the muscles that cross over the bursa or the associated joint, which will relieve some of the pressure on the bursa. This is also a good candidate for icing, and identifying the cause is often key. From a medical point of view, if it's an infection, antibiotics are given. Steroid injections can be used, and in rare cases they can be drained or removed. Bursas may grow back if they have been surgically removed. That's all you need to know for ligament sprains and bursitis. You can now complete the quiz associated with this section and move on to fractures.